students, today discuss about the physiologically and sports. This chapter, this topic is effect of exercise on cardiovascular system. So there are the two type of the effect. One is immediate exercise and a long-term exercise. So what will be the effect on immediate exercise? What will be the effect on long-term exercise? What will be the effect of immediate exercise on cardiovascular system? What will be the effect of long-term exercise of cardiovascular system? So first we discuss about the immediate exercise of cardiovascular system. So after immediate exercise, the increasing the heart rate, the elite or best endurance athletes usually have a 28 to 30 beats per minute, increasing the heart rate, and normal person they are having the 32 per minute. Okay. uh, so uh, and after immediate exercise, those who are good athlete, their heart rates remain in 28 to 40 per beat in per minute. And the next one is that after immediate exercise, the increasing the stroke volume. The increasing the stroke volume is the amount of blood eject per beat from the left ventricle. It is measured in the millimeter per beat. So experienced athlete during exercise, it will be the 100 to 10 to 100 to 30 millimeter per beat, and experienced athlete at the rest in remain time 90 to 110 millimeter per beat, and untrained individual at rest remain in 50 to 70 millimeter in per beat, and increasing the stroke volume. And next one is the increasing the cardiac output. Increasing the cardiac output, uh, immediate exercise, it will be affect that cardiac output is the amount of blood pumped by the heart in 1 minute. It is the measure of liter per minute. The at rest, the cardiac output in about 5 liter per minute, and during the exercise 20 to 40 liter in per minute. And and next one is increasing in blood flow. Next one is increasing in blood flow, that at rest 15 to 20% circulating the blood supply to skeletal muscle uh, after immediate exercise. Then during exercise 80 to 85% increasing in cardiac output, and it is redirected to the skin to enhance heart loss. Next one is the increasing in the blood pressure. The increasing in blood pressure after exercise, blood pressure that will be increased during this resting position. The systolic blood pressures range is 110 to 140 mercury, and the diastolic blood pressure is 60 to 90 mercuries, and during exercise position of systolic blood pressures range in 200 to 250 mercuries, millimeters mercury, and diastolic pressures usually remain unchanged if there is a increase of more than 15 millimeter mercury. As exercise intensity increases, it indicates the coronary heart diseases. Uh, if this mercury is increasing the 15 millimeters, okay, then it's indicated the coronary heart diseases. And next one I'm talking about the long term effect of exercise. What will be the effect of long term exercise in cardiovascular system? First one is that increasing in the heart size. The heart size that will increased a long term exercise, and the size and strength also increased. And then next one is that decreasing in resting heart rate. So in untrained, the 50 to 70 millimeter per beat, and trained decreasing in resting in heart rate is reducing 10 per beat in per minute. So it's long term exercise, so heart rate decreasing at 10 beats in per minute. and then and I'm talking about the I'm talking about that trainer athlete. Means after this training time, his resting heart rate may be reduced up to 10 beats per minute. Okay, after regular exercise, heart finally become more efficient. Then stroke volume increases at rest. Regular exercise help in increasing the stroke volume at rest. The stroke volume at rest remain up to 40, 50 to 70 millimeter per beat. An untrained individual and 60 to 70 to 90 millimeter per beat in trained individual, and 90 to 100 millimeter per beat in best endurance athletes. So stroke volume increases in rest position. And next one is a an increased in cardiac output. Increases cardiac output in untrained athletes at 40 to 12 liter in per minute, and then elite and trained athletes there will be the 25 to 35 liters per minute, increasing in cardiac output. And then cardiac output can be as high as 40 liter per minute at rest positions. And next one is the increasing in the blood flow. Increasing in blood flow is means that the blood's re uh, distributions become more efficient and effective. As a result of above mentioned fact, there is an increased blood circulations in a body, and then decrease in blood pressures. So after long term exercise, blood pressure will decrease. That is the systolic and diastolic up to 10 millimeters mercury decreasing at the rest position. And then increasing in blood volume, increasing it blood volume, it means that in the body produce a greater number of red cell uh, after exercise, after long term exercise, greater number of red volume cell in order to keep the muscles supply with the oxygen during the heavy exercise. And then quicker recovery rates. Beginner the heart rate become normal, and train recovery rate is fast. So after long term exercise, those are beginner, their heart rate become normal, and those are trained athlete, heart rate recovery rate at a rate is fast. And uh, next one is reduce the risks of heart diseases. After regular exercise, gradually they reduce the stress related hormones from the circulatory in the bloodstream. This increases the blood vessels path, which is turn lower the risks for developing the plug that can lead to coronary heart disease. Hence, exercise reduce the risks of heart diseases. And next one, talking about the effect of exercise on respiratory system. What will be the effect of exercise on respiratory system? So there are some points I discuss. So exercise after exercise, the willpower will strong of willpower will strong. And then regular exercise increasing the willpower of the individuals. And then then next one is increasing in tidal air capacities. The tidal air capacity is amount of air that flows in and out of the lungs in each quite respiratory movement. It is estimated at about 500 to 800 cc. And then after doing the regular exercise, it has been noted that this air tidal air capacities can be increased. And decrease in rate of respirations. It is the certain that when the beginner start in the exercise, his rate of respiration increases, but when some individual perform exercise on the daily basis, his or her rate of respirations at rest decreases in the comparison to the earlier stage. Then strengthen of diaphragm or muscles. So regular exercise strengthen diaphragm muscles and the muscles of the chest, and then the diaphragm and muscles of the chest. Avoid the second wind. This is the very important thing, to avoid the second wind. For the beginner of the stage, the second wind is indeed of crucial stage, but for the person who does regular exercise, it is hardly felt, and sometimes a well experienced athlete does not feel it is his course of activity. And unused alveolus become active after regular exercise. Unused alveolus become active. uh, then it's because much amount of oxygen is required in the vigorous and the prolonged exercise. The passive alveolus also become active. The next one, increase the endurance, that after exercise, the endurance that will increased. And then increasing the residual air volume, residual air volume, that amount of air which is left in the lungs after exhalation. So residual air is the amount of air which is the left in the lungs after exhalation. So if the individual perform regular exercise, is the residual air capacity increased in comparison to an individual who does not perform regular exercise. Increasing the size of lungs and stage, that after regular exercise the size and lungs and chest will increase. And then next one is prevention of diseases. Prevention of diseases, that is also very good. After effect of exercise, after affecting of exercise, or after exercise, the most probably by the speed of inhalation, exhalations become less. Is an individual who does not any exercise, the waste products start sticking or to his or her lungs. With the passage of time, his or her lungs get damaged. On the other hand, if we perform regular exercise, we will have to inhale and exhale more air speedily. By doing so, the waste product will never stick to our lungs. These products will come out automatically, and the lungs will not be damaged in this way. It can be said that by doing exercise we can prevent various diseases. Okay. Next one is increases in vital air capacity. It is the amount of air which is individual can inhale and exhale with maximum effort. This capacities varies from 3050 cc to 4000 3000 sorry 3500 cc to 4500 cc is normal, is in a normal adult. It is the sum of tidal volume, uh, inspiratory reserve volume, and expiratory reserve volume. Within regular exercise, a person capacities may increase up to 5500 cc's. So this is after exercise, what will be the effect in our respiratory system, that already we have discussed. Now discuss about the circulatory system. Easy one. Circulatory system, discuss about the circulatory system. Not circulatory system. Circulatory system is this system is out of syllabus, deleted of syllabus. But discuss about the muscular system. So no problem. So it just will go once have a look once time, that after exercise, the increasing in the size of heart, that decreasing in the heart rate, and then the increasing the stroke volume, and the decreasing in the cholesterol levels, increasing in the number of efficiency of capillaries, increasing in the number of RBCs, increasing in the number of WBC, DLA, fatigue, fast recovery period, prevention of diseases. This is for the effect after exercise on circulatory system. And then effects of exercise on muscular system. So when we do the regular exercise, some permanent changes take place in our muscular system. Following changes in our muscular systems can be seen in if exercise are done in regular basis. So what will be the changing is the change in shape and size in muscles. So through the regular exercise, the shape and size in muscles is changed. In fact, cell or muscle is are enlarged, which change the shape and size of muscle. Next one, formation of the more capillaries. Even the exercise are done in color of muscles change the because of the number of new capillaries are formed for the better efficiency of blood circulation. Next one is the muscles remain in tone positions. Indeed, the muscle remain under some degree of contractions. Muscles become firm and maintains a slight and steady pull on the attachment. So after exercise, that control the extra fat. Exercise burn the calories which is taken in the form of fat. And the next one is after exercise, the muscular system, the change in the connective tissues. The connective tissues which connected fibers become powerful. These tissues can bear stress to strenuous activity and can be extended up to some degree. Then after exercise, efficiency in the movement of the muscles. So this movement of the muscles become efficient and smooth. Movement of during different activities become attractive. Then delay fatigues after exercise. Though the fatigue is mainly due to the formation of carbon dioxide, lactic acid, and the acid phosphate. The accumulations of carbon dioxide and acid phosphate and the lactic become less in the individual who perform exercise regularly. Hence, fatigue can be delayed if exercise are performed daily. And they increase the food storage. The food storage capacity increases when regular exercise are done. This food storage of food can be utilized immediately when it is needed. The exercise makes the fatigue beautiful. That's very good point, this one. If we perform regular exercise, we will be able to make our body beautiful. It can be seen that Miss Universe competitions, the 26 34 26 figure does not come up by chance. It is only possible through the regular and vigorous type of exercise. And the non-functioning fiber become active. So when we do not do any strenuous work, all the muscles fibers or our body do not perform any work. In fact, this fiber do not need to be active, but when we perform exercise regularly, the non-functioning fiber also become to be active. So consequently, the strength of this body increases because the total contractile contractile power of the muscles fiber increases. And next one is body posture remains correct. So body posture remains correct by doing exercise regularly. The strength of muscles increases, which is turn keep the body posture is correct position. The postural deformities do not occur if there is an for physical deformities. It is removed by doing regular exercise. So and last one is improve the reaction time. So due to the regular exercise, the speed of nerve impulses increases, which ultimately the improve the reaction time. These nerves impulses move very quickly through motor nerves from nervous systems to muscle fiber. So owing to this, the reaction time improves. So during exercise or after exercise, so there will be the effect of muscular system. uh, so improve the reaction time, then the body postures, then non-functioning fiber active, then increasing the food blood storage, delay fatigue, then control fats, muscles remain in tone positions, a change in shape and size in muscles. So these are for the cardiovascular systems, and these are for the muscular system, effect of exercise. Also we have discussed about the muscular systems, and discuss about the cardiovascular system, discuss about the respiratory systems. Okay, so today's of this much. If you have any doubt, anything, any queries, you can tell now. Thank you very much.